so happy to be here with you all to present some information about autism supports in schools. My role right now is my name is Tanya Semerad. I am the Autism and Significant Cognitive Disability Specialist in at the Utah State Board of Education. I also do a lot of work with paraeducator resources, which is very important because as you'll realize, like most of my career, this is my 34th year, has been working with students with pretty significant support needs. And so I've just counted on paraeducators so much. So I just want to let you know that at the end of this, if you have further questions about autism, about students with significant cognitive disabilities and instruction for those students, or paraeducator supports and resources, I'm your gal. Okay. So as I said, I've been doing this for 34 years. My role has been across the board. So I worked in a non-for-profit school in California, Northern California. Even though I'm from Utah, moved there for a few years when I first graduated from college, way back when. And I was working in a school in California. If they have really challenging students, they pay for certain non-for-profit schools to take their kids and to, instruct those students. And so as a young 23-year-old, I worked at a school, a non-for-profit school in California. All of my kids they weren't all on the autism spectrum, but they all were one-to-one students. So I had 6 kids and I had 6 paraeducators. So I just got my feet wet really quick with some of the most challenging students I've ever worked with. And maybe someday I'll write a book because it was really fascinating and such a learning experience for me. And then I have worked at the Pingree School for Autism. I worked at Granite School District in a self-contained classroom. And I was an autism specialist at Granite School District, an inclusion specialist, and now at the USBE, Utah State Board of Education, I am autism significant cognitive disability specialist. I'm really honored to be here with you today. Again, I only have 1 hour. So I have very content-rich slides, which several of them I'm going to just speed through. And some of them I'll go more in depth. But I want you to walk away with some information that you can go back and look at. And I don't know if we've got this uploaded yet, but you will have access to these. I've talked to our wonderful preschool team that's doing all this work, and we will make sure that you have my slides uploaded. And so you can be like, oh my gosh, I remember Tanya said something or other about this or that, and I want to make sure that I can access that information. But again, you can also always reach out to me. It would be super helpful. I can't really monitor. Wait, maybe I can monitor my chat. Let me see. Oh, I can. Okay, thanks, Christina. Okay, so I don't have a ton of time to get to know you. I'm so sorry. But I would love to know, just tell me 3 things. What is your role? Parent, it could be several things, right? You could be a parent, you could be a paraeducator, you could be an early childhood educator, an administrator. So I'd love to know, one, what's your role? Fist to 5, give me a number. No experience with autism would be a 0. 5 would be, I know all this. I'm just here because this sounds interesting and I could probably teach this course. And then, somewhere in between. So if you guys wouldn't mind just plopping that in the chat so I kind of know who's here. And then you can sign in through this QR code, but I'm not desperate for you to do that. So I would love to see, I don't know if anybody's putting anything in or if I'm missing it. Okay. So let me continue. What I really want you, oh, thank you, Devin. ASL Special Education, 3 for experience with autism, want to learn more. ECE, and I'd say I'm a 3. Thank you, Alicia. It just gives me, it's good to have some context about what your experience is and what you're doing. Lauren, special ed teacher, Leanne, parent of adult child with autism and an SLP. Thank you so much. Okay, I appreciate you guys continuing to give me that information as I get going. Preschool teacher, Alicia again, knows a little bit about autism. You're at a 3. Okay, perfect. Now I think I skipped through some slides. So let me go back. Okay, so what we're going to do today in a quick, sorry, downloading of information or uploading. I want you to know a little bit about the challenges, the manifestations, the strengths of our students on the autism spectrum, and then also some supports for those students in our schools. So, not going to spend a lot of time, as I said, I don't have a ton of time. I want to tell you one thing. In my presentation today, I will refer to I will use identity or person first language versus identity first language. So I'm going to say a person with autism, a student on the spectrum, etc., versus an autistic person or an autistic student. I want you to know that education and research terminology is kind of shifting because the autism community, those that are at least able to kind of present their desires and thoughts are that they actually don't hate being called autistic. And sometimes that's really what they want to do. And so, what they want. So, in general, I just want to let you know, I'm going to say, person with autism, student on the spectrum, etc. But if I were to meet a person with autism who was able to explain to me their preference, I would start with that. And if they were like to say, autistic teacher, autistic artist, those kind of things, like that is actually a thing that has come out in the community. Like many people on the spectrum that are able to communicate, for themselves and advocate for themselves have said, we don't think it's a bad thing. We love this about ourselves. We want it to be the thing that like goes in front of you. They'd rather have identity first. So just know that as you're looking at literature, like I'll give you the example of the Utah Parent Center. I've been talking with them and they're basically doing both. Like within a presentation, they'll say both. Just to kind of honor everything. I've seen some research articles recently that like the title might say students with autism, but then within the article, it will say autistic students. So I like to just give you that little bit of information about some of the language changing that might be happening and just being aware that people on the autism spectrum that are able to, those that maybe have strong opinions have said, I don't want you as a researcher, you as an educator, you as a teacher, even you as a parent to label me the way that I don't want to be labeled. So putting that out there. I have a quick definition here of autism spectrum disorder, and this comes directly from the Individuals with Disabilities Act, so IDEA, and we're not only talking today about students that are receiving special education services, but this pretty much is a good way to talk about what we're looking at with this disability. So two major things. There's going to be, and if you look at the DSM-5, you're going to see very similar kind of eligibility criteria, etc. So we're talking about two things. This disability has two very, very hallmark challenges. And one is verbal and nonverbal communication, and then social, interaction, communicate, social abilities. So those are the two things that we're really looking at with these kiddos. And then, of course, there's those things that we know can be a part of it. So like repetitive stereotype movements, resistance to environment change, in whatever, but change in daily routines. And of course, there's those sensory experiences that I'll talk about in just a minute. So currently, here's some data for you all. Not much to concern you, but I think it's good for everybody to be on the same page. So the CDC's Center for Disease Control reports 1 in 31 children are diagnosed with autism nationwide. Here in Utah, we report 1 in 37 children have autism. And these are age classified, like there's a whole system through the Utah Registry for Autism and Developmental Disabilities. One thing that I think is very interesting is that in Utah, we're one of the only states that takes two data sets to determine that 1 in 37. So legislatively, our doctors, medical doctors who diagnose medical diagnosis of autism are required to report that to the Utah Registry for Autism and Developmental Disabilities. So that's URAD. They are required. That's legislative. You've got to do it. The other thing is that Utah is a little bit different than some other states because we actually gather information from our schools. So, one kind of one fact that some people get confused about or don't actually understand sometimes is that you do not have to have an a medical autism diagnosis for a student to get an autism special education classification. So we have very, very robust eligibility requirements that we would do. So, and when you think about it, like it's kind of not fair, right? If a parent doesn't have access to a medical doctor to get that diagnosis, but they can get it through the schools. So we have very, very like rigid eligibility criteria, and I'm not going to be able to go much into that today, but some students don't have a medical diagnosis, but they still have an autism classification because they've gone through all the criteria at the schools to make that determination. Just one other thing I just want to make sure that you understand, which I think is fascinating. I mean, you guys are working with the littles for the most part, but it's been reported that males are 4 times more likely to be diagnosed with autism other than females. However, females test differently. They show characteristics differently. They mask, that's a term, differently than our males. So our males, our boys, a lot of times they're squirrely, they're loud, and I don't mean to make a huge generalization, but like they're more obvious, right? So when we're doing checklists or whatever, like we're like, oh my gosh, yes. Where our females are very often uh, more withdrawn. And for a long time, they've said, oh, if you have a student that's a female or a child that's a female with autism, um, their females are always more severe. That's actually not the truth. We just were missing the more mild, moderate females. So I think that number is going to change as we, in research and our, diagnostic tests and everything are refined. I think we're going to catch more of the females, and I think it's probably actually closer to even Steven with that. Okay, just for a little bit of information here. So when we are talking about, oh, let me go back. When we're talking about autism, there's very, very often co-occurring conditions, which can be confusing, which can lead to like we don't understand which is what, right? Like why are we having this situation? Is it the ADHD? Is it the autism? And so that can be confusing, and I'm not here to resolve that for you, but I think this is really interesting. for you all to look at these facts. So I find the ADHD is very fascinating, very high as a co-occurring condition. Anxiety, very high. And as we talk about some of the characteristics and some of the challenges for these students, I think that will make more sense. Sensory is a little bit up there. The intellectual disability, so a lot of times people assume that somebody with a medical diagnosis or an autism classification means that they're intellectually disabled as well. So their cognitive functioning is going to be, below 70. Look at the percentages here. That's not necessarily true. Like only 9% overall have an intellectual disability as well. Sometimes it presents like they might not be able to cognitively track things and understand things, but I think that has to do more with the communication and social component of the disability. Okay, so let's talk about what's so amazing about my friends with autism, because there are very often amazing strengths. Even like so, again, my career, I've worked among the spectrum of students really high support needs, students with mild support needs, and I could pretty much even say for those students that have really intensive support needs have somewhere fallen into these strengths. And I think that's really important for us as we're working with these kiddos to look at, okay, well, what does this mean for them? Like, what can they bring? How can they best learn, etc. So obviously, like attention to detail, we'll talk a little bit more about why that happens for these kiddos in their brain, memorization, following specific directions, which can be lovely. I mean, one thing that's really cool about kids with autism, and I'm speaking in generalizations. I hope you guys realize that, but in general, our kiddos, our people on the autism spectrum um, are more concrete, literal thinkers than abstract thinkers. So if this is the direction, that's what the direction is. And there's not a lot of flexibility, which can be really good in some circumstances, but then also we all know in life as we're going through life, there needs to be some flexibility with directions and how to do things and all of that. So, just keeping in mind that's a strength, but can also be a challenge, especially if you've got a student that likes to tell everybody else what the specific directions are and they're not following them. We've got splinter academic skills, can be very common. So, math and science is often something we're seeing. I think also like some of the uh, um, technical type of things. I've seen so many kids do so many cool things that I would never be able to do when like even creating a PowerPoint or going into some sort of creation of something that has to do with technology. Like amazing. Logical thinking, again, not abstract, just like we're looking right at the facts. Honesty and reliability. I'll talk a little bit more about that in a minute. Most of our kids with more significant needs on the spectrum have a really hard time lying, and I'll talk about why that is. The drive for perfection, alternate problem solving. So a lot of times we are not flexible in our thinking, and so we think it has to look this way. And our people on the spectrum might look at things very differently than we would ever think of. And then, of course, because this is a communication disability, verbal, nonverbal communication disability, visuals can be super, super supportive. And that is one of our best ways that we can support these kids. Now, here's where we struggle with our guys and our gals. Transitions. This has to do with executive function, and I'll talk about that in a minute, but I went into a first grade classroom. This was years ago. I was taking data on a lot of things, 3 days of data. And in the first grade classroom, um, They did an average of 93 transitions throughout the day, which our littles need a lot of input, a lot of change of environment, change of activity. But if you have executive function deficits, which our kiddos with autism typically do, you transitions are incredibly hard. So if you're trying to catch up constantly, this causes a lot of problems for our students because they're constantly trying to catch up. And we think they're just being naughty, but literally their brain can't make that shift that quickly. So it's like, oh, they're so non-compliant. And sometimes they are, but also there is a true, real component to what happens in the brain with transitions and being able to process that information, to finish this task, to move on to the next. It can be really super challenging for our kids, which a lot of times leads to us thinking they're just naughty. Schedule changes. I don't know about you guys, but there are certain things. I don't have high anxiety. Knock on wood, I'm pretty blessed with that. But even when I'm a little anxious about things, I like to know what's about to happen in front of me. And so for our kids that are very concrete and they just feel comfort, I think you might as well feel comfort in knowing what's about to happen, right? And what are the expectations for that? And for these people on the spectrum, it's like to an extreme. So schedule changes are very, very challenging for our students. Behavioral expectations. We are thinking because most of our kids, not all, I'm not just talking about autism, but many of our kids are able to just learn because the rules are on the wall. You're getting your teacher's thumbs up. You're seeing what your peers are doing and what the expectations are. So you're learning from that. Very, very much so because of this disability. These kind of expectations have to be explicitly taught and explicitly reinforced. So if we're assuming, like most of our kids, they're just going to catch on, that is not the case with our kiddos with autism. Maybe a little bit here and there, again, it's a spectrum, but I'm telling you, for the most part, if we're like, oh my gosh, can't he just see or she just see how you line up or how to walk down the hallway? Very often you actually have to teach it explicitly, reinforce it. There's a different bunch of different ways to teach that and reinforce it, but it doesn't just happen naturally like it does for many of our kids that are more or less neurodivergent. Communication, obviously, that's a hallmark deficit for our kids that has to do with input, processing, and then also output and what we're giving to those around us. Attention skills, I mean, I just showed you the co-occurring conditions. ADHD is very common. But also, I want to just let you know, if you live in a world where you're confused all the time, transitions are happening all the time, you don't understand how to process the communication information that's coming to you, you stop paying attention. And that's what's happening with our students very often. I've mentioned information processing a little bit, takes longer, looks different. Social situations is again a hallmark deficit. Friendships. A lot of people assume that our students with autism don't want friends. They do. They don't. They just, it maybe doesn't fit into the mold of what we think friendships need to look like. And they don't know how to approach making that happen, how to actually be socially aware. Again, needs to be explicitly taught, like, I know you have this interest, but your buddy Johnny has this interest. So we're going to work on, you can talk about this for a few minutes and then he can talk about his thing for a few minutes. Those kind of things. Personal space. Emotional regulation has a lot to do also with executive function disability. Sensory regulation, I'll talk more about, and then academics. Perseveration on a specific item or topic. So perseveration, if you haven't heard that word before, really is like an obsession, or if you want to put it more in a positive term, I'm starting to use more like a passion, right? And I think if we were in a different space and time, I would certainly love to open this up, and you can put it in the chat. I would love to know, for those of you that have worked with students on the spectrum, what passions about topics or items you've seen with your people that stand out to you. So I'll give you a few. I have a lot because I've been doing this 34 years, but I'll give you some of the more common and interesting. Oh, car registrations. Leanne, I've never heard of that one. I love hearing new things. That one's new to me though. Maps, street signs, medical procedures, vacuums, tornadoes, weather patterns, um, uh, trains, very common. Um, oh, ABAC, what's that? What is that, Alicia? Spell that out for me. Oh, ABC. Okay. ABC. Oh, that is another one that I've seen a lot, are like logos. Like kids really get obsessed with like logos and drawing them. So it might be, Taco Time, it might be Paramount or Disney or whatever. Two of the most fascinating for me, and I'm aging myself here. I had a kiddo that, I don't know if you guys ever watched American Idol, but he was a runner-up, I think, Clay Aiken. I had this kid that was obsessed with him. And this was probably, I'm getting old. This was probably like 20 years ago. But if we told him Clay Aiken wanted him to blah, 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 he would do it. Um, and then one of the really, really interesting ones for me also was a 40-year-old gentleman that I worked with who was in a group home and really having some behavior challenges. So we're like, okay, we got to figure out what's going to motivate this guy. And he was passionate about, you didn't know this, as I didn't understand about car registrations, but he was super passionate about international bus sounds on YouTube. So you can literally Google or go to YouTube and search what does the Greyhound 657 sound like in London versus Paris. I don't know. It was fascinating to me. But the thing about these passions can be problematic, but they can also be helpful when we're trying to motivate. Obviously, the engagement in repetitive movements or routines we see often with our students. And I think a lot of these we're understanding more have to do with like self-regulation, like trying to regulate. So like pacing, fidgets, those type of things, humming, rocking, those kind of things tend to be like a self-regulation or self-soothing kind of behaviors. And then we already talked a little bit about concrete, literal thinking. I don't have time today. I want you guys, if you're really interested in understanding the autism brain, and the reason that I share these links with you when you are able to access my slides, you can go click right on these, and each of these videos are probably about 5 to 10 minutes. So probably 30 minutes total. They're so good. They're so interesting. But these are three components that really have to do with the autistic brain. And good and bad comes from both. Good and challenging, I guess, should be the word that I say. So executive function skills really have to do with, that part of our brain that processes many different things. It has to do with our working memory, problem solving, organization, um, emotional regulation, those types of things that is very effective for our students with autism. Again, it's a spectrum, so less impact for some kids and more for others. But executive function, if you get a chance, watch this video, you'll be like, oh, that's why, Joey really is struggling with these things because they're not naughty, their brain just isn't there. And so, like, I just really encourage you to go look at that and consider it. I also am happy to give you more resources if you email me regarding how to accommodate executive function deficits and then how to help build those skills. Theory of mind is kind of more of a scientific term. You might hear it as perspective taking more amongst people in the world of autism, but this is really the idea that I know that my mind, my feelings, my thoughts, my experiences are different than, we'll say, Leanne's, because I see her name right there. I know, because I have theory of mind, that she maybe doesn't like Disneyland, even though I like Disneyland. Or maybe she does like Disneyland, but what she wants to do there is different than what I want to do there. And what the rides I rode are different than the rides she went on. The food, oh my gosh, the food at Disneyland. But I get, like, Leanne's brain processing emotions, experiences are different. When you have a struggle with theory of mind, this causes so many problems with our kids in schools. So it looks like they're just so selfish and they only want to do what they want to do. And this is a big part of why they have a struggle with making friends. They, I'm going to say, I'll give you a name. I'm going to go with Dylan. Dylan thinks because he really is interested in the Salem witch trials, sixth grader, um, that means everybody else in the class is really interested and wants to talk about it, including the teacher who's trying to teach something different than Salem witch trials. I mean, that was 20 minutes ago. And there's this lack of understanding that we've moved on from that. A teacher has a different agenda. Students have different interests. And this gets really, really challenging with some of those things with like relationships, with sort of just going with the flow in school, and being able to adjust to the fact that people around you have different agendas than you do. Central coherence, really quickly, we all have central coherence. It's weak or strong, which sounds like one's good and one's bad, but that's not actually the case. So our kids on the autism spectrum typically have weak central coherence. So that means they're super good at the details. So they like not only see the tree in the forest, they see every individual leaf and perhaps like I don't know terminology, but like, the veins of the leaf or whatever. Like they see that detail oriented kind of picture versus strong central coherence, which is my case. It sounds great, but it's not necessarily great. I am very good at the gist. So if you asked me, what was that movie about? I can be like, oh, there was like a little fish that got lost at sea. His parents were looking for him. He met a lot of friends, right? But if you are talking to somebody with weak central coherence, they're like, well, the opening credits look like this. Here was the song they played. It's a very, very fine-tuned attention to detail, which can be amazing for certain aspects of learning and working and their post-school kind of outcomes. But these kiddos struggle with like, well, what'd you do this weekend? They already have the language or the communication disability component, but then it's also like they like, well, at 9 a.m. I did this on Saturday versus like, oh, we went to the mall and I, went to Hot Topic. I don't know. I'm just making it up. But so that these are three very, very significant components that affect people on the autism spectrum that often people assume that they're naughty, but this is their brains their brains, this is how their brains are working. Okay, not going to spend a ton of time here, but I want to make sure that you know that we have kids in our schools. And I know for you guys are early childhood educators, so I'm obviously very often, not always, but looking at, especially if we're looking at special education services, right? We're looking at that developmental disability classification. But in general, we have kids on the spectrum that are in our schools and they don't need necessarily extra supports compared to their peers, right? So, universal design for learning, which is great for all of our students, which is a really good way of like making sure we're getting different representation for output to our kids and that we're able to pull forward from them different ways of letting us know what their knowledge is, their understanding, those kind of things. So we've got those kids. Like to me, the way that I can talk about this is like, oh my gosh, Sarah's parents are going through a divorce and she's struggling. So she needs like a little extra supports, right? Because we're teachers, or educators, like we want to support our kids. Same thing for a lot of our kids with autism. They don't, they might have like mild autism support needs. And so we're just talking about like, yeah, I'm gonna see what they need, support it how I can. Then we've got those kids that have 504 services needs, and that really is that we're looking at accommodations so that our kiddos can access their educational programs and activities, right? So not really worried here yet about making progress, but access, right? So accommodations for so many kids on the spectrum are very helpful. Things like visual schedules, extended time, sensory kind of supports, those kind of things can be a part of a 504. Breaks. And then we've got our IEP kids. Those are our kids that need special education services, which also can include those accommodations I was talking about before and usually do, but that we're really talking about specialized instruction is necessary for these students to make progress in the core curriculum along with their non-disabled peers. And just, I'm assuming most of you know this, but maybe not. Our kiddos that are on an IEP with an autism classification never means that equals this in terms of placement, right? We've got students that are on an IEP with an autism classification that spend a good amount of their time in a very inclusive setting, learning along with their non-disabled peers. We've got those kiddos that are in more of a special class kind of setting because that's what's appropriate for them. We've got those kiddos that might be in a special school, but it always needs to be discussed. Okay. The one thing I just want to say about this for those of you that are looking into, and again, please reach out to me with eligibility questions. But for a student to have an IEP with an autism classification, this is part of the criteria. And I'm not going to go deep into that today, but they have to exhibit significant impairments in verbal and or nonverbal communication and social interaction. So if you have a student that's on an IEP and they have an autism classification and you have, first of all, within your evaluation, you have not determined that they have significant impairments in communication and social interaction, that might be the wrong category for them. And then if they do, yes, okay, we got the right category. I'm not here to tell you, I'm not on your IEP team. I'm not predetermining anything, but you probably want to make sure, probably want to make sure that your IEP is addressing these significant impairments in communication and social interaction. I'll give you one quick example. This does not have to be services provided by a social worker or a psychologist. SLP can be a speech language pathologist, but here's one quick example. Student does not the goal would be to be able to ask for help. So recognize when they need help, which is often a really big challenge for these students, and then how to appropriately ask for that. That's one goal that could be meeting both a communication and social um, uh, concerns, right? So, because like if they're not asking for help, they're socially being inappropriate because they're, running out of the room or tearing things up or screaming or whatever, right? And a social appropriate way is like, oh, I need help. And then it's also communication, right? So just I like the ask for help example because I think that is to just let you know that it doesn't have to be like super, in depth. It can be, but these two overlap very much, and very often the communication and social interactions. Okay, I'm going to give you some tips. Let me see how much time I have. Okay, 20 minutes. So, I want you guys to consider sensory issues first. Here's the deal. This is a common thing for our students on the spectrum. There are several people that have sensory issues that aren't on the spectrum, but this is pretty much part of that. Like if you go to the diagnostic manual, this is a component of it if you're a medical practitioner making that diagnosis. Okay, so imagine feeling regulated. I don't get to see you guys right now because I'm in a webinar, but I want you to think about when you feel the most regulated. Like you're not hungry. I don't know if you guys even had lunch yet, or if you're just eating over this, but you're not hungry. You had a good night's sleep. You are comfortable with. You're not too cold. You're not too hot. You're not sick. You don't have a sick child in the other room. You don't have a lot of anxiety because you got bills to pay or whatever. Like you're regulated. Okay. So think about a glass of water. So, and think about that glass being half full. So if it's half full, let's just use that as an example. You're regulated. Okay. So I feel pretty regulated right now. I'm probably like half full at this moment in my lifetime, in this room presenting to you guys. If you're a sensory avoider, your cup of regulation water is full already. Okay, so I'm half full, I'm regulated. These sensory avoiders, their cups are always full to the brim. That's just part of their disability. And one drop of water into their cup causes all kinds of challenges. So the drop of water for these kiddos might be a noise that we can't even hear because we don't have that part of our brain that like, logs into that. It might be that they've got a tag on their shirt. It might be that the kid next to them is tapping their pencil that we would never hear. Um, uh, maybe they're too hot, they're too cold, had a terrible night's sleep. Like there's all these things, but their cup is full. And a lot of these kiddos are those kids that we say, oh my gosh, they just lost it for no reason. But we don't know the reason, but some kind of drop of water went into their very full cup. And it it put them into a very overregulated state. And then we've got our sensory seekers. So their cups have hardly any water in it, and they just need more to feel regulated. They need more sensory input, right? So imagine these kiddos that are pacing, they're humming, they need fidgets, they're rocking. A lot of my littles that I worked with that are sensory seekers like to put like things on top of them. So like, maybe not even appropriate. Like, okay, I'm going to take all these books off the shelf and lay them on top of me. Like they're just trying, we've heard about some of those vests that kind of give that sensory input for our kids or weighted blankets those kind of things for our sensory seekers. Now, for both of these, there are tools, supports that you can once you get to understand where that kiddo is and what their needs are, that you can implement. And again, I have several pieces of information I can share with you if you want more on this. But I'll just tell you, like sensory avoiders, very common kind of things, headphones, if they're willing to put them on, which is not always the case. Um, seating where they're maybe not near the loudest student, where they're not like overstimulated by stuff outside the window. A lot of my avoiders, I say, give them, if they're desk kids, give them two desks. So they're not like having somebody super close in their space. Our sensory seekers, there's a lot of things you can do, like, okay, you're the kid that's going to go ahead and if there's a whiteboard, you guys have got the littles, so I don't even know if they could reach your whiteboard, but or if you use them, but like they're going to erase it. You can have them pass out papers. You can have them even like a very common thing is like carry these five heavy books down to the office. And the office is like, okay, now carry these other five heavy books back. There can be just like if you have the supports to do this, like, okay, we're gonna at this time of the day, you're gonna go run around the gym 3 times. If you want, like we're not gonna force a kid to run around the gym. But keep those things in mind because they're very important with our students and their sensory needs. Providing handwriting alternatives. I know we're talking about the littles today, so it's not as big of a deal, but there's actually research out there to show that for what happens for most of us, which just becomes like habit and we don't have to process what we're doing when we're writing. Like I can write letters without thinking about how to shape them, right? But there's actually research to show that that component of the brain for people with autism doesn't become automatic. So, I joke about it, but the two biggest things in my career for our kids on the spectrum I happen to see for IEPs are transition situations and then handwriting. And so I just don't I believe the research. I don't think like all these kids with autism got together and said, let's just really mess with everybody and tell them we hate handwriting. Like there's literally they're trying to process through some of those challenges they have with the understanding what they might be needing to write, especially when they get older and they're having to write like content, and then the shaping of it. And especially if we're talking about students that might have like a OCD component, obsessive compulsive, like they need it to look a certain way. So my thing with this is try to do your best. Like sometimes you have to handwrite, right? But if your goal is to determine what their knowledge is, think about different ways to gather that information. Can it be verbal? Can it be speech to text? Can their buddy write it for them, those kind of things. So just keep that in mind. Reinforcing our expected and appropriate behavior. So I feel like we're all really good, especially you guys with the little preschoolers. You guys are all so positive. And I love that. That's how I was as an educator too. Like, oh my gosh, I love how you are, blah, blah, blah. But what happens a lot of times, especially with students that need sort of major behavior change, is we think we're reinforcing the good, the appropriate stuff more than we actually are. So a quick example that I have when I worked at Granite School District, I would go into the classrooms. At that time, I don't really get to do this anymore, but I would kind of go in as a consultant and I would go in and take a bunch of different data because they're like, this is the worst kid I've ever had. You're not going to believe this. And so I'd go in and I'm like, I know, like I had them too. I understand what you're saying. I had very challenging students, but I would take data and what very often happened, which was very frustrating for the teachers, is that the kid would be the best they've ever been in their whole entire lives when I was there taking data. And they're like, I don't know what to tell you. Like this, I've never seen this great behavior before. And I'm like, okay, well, I was here for 45 minutes and they were doing so many good things. And I didn't see one instance of you high-fiving, stickers, good job, doing blah, blah, blah. Um, like, and I get that because a lot of times we're like, oh my gosh, for once they're not crawling under the table. But when they're not doing that is when you got to jump in. And so, in general, when we're talking about behavior, you want to do 4 to 1, 4 positive comments to 1 redirection to 1 correction, 4 to 1. When we're talking about major behavior change, we're talking 12 to 1. You guys got the littles. This is your chance. Like, it's going to be like, oh my gosh, really 12 to 1? But yes, because that's going to make things so much better for them, their classmates, their future teachers, their parents, all the people in the world. So there's a lot of supports you can have to make sure that you're doing that. Nowadays, back in the day, I had a beep tape, weird cassette. It would go off every 2 minutes and it'd go beep. And I'd be like, oh, that's a reminder. I got to make sure that I'm looking at all the kids and giving the appropriate reinforcement. But now you can just set a timer on your phone and come up with your team. Like, how often do you think you need to be reinforcing what you want? So we already talked a little bit about using their strengths, interests, and passions, making visual supports. So here's the thing. Think about this for just a minute. Right now, all the words that I'm saying go away as soon as they leave my mouth. But I have right here for you 2 visual supports to add to the words I'm saying. So I've got the PowerPoint, which you're going to be able to access later as well. So that's another visual support. And then below I have captions in case, you know, that's the better way for you to like process information. If you have a language communication disability, processing language disability, visual supports are your best way to go. And so, and I would say think outside of the box. So if you're doing like some sort of reinforcement program, any kind of behavior expectations, even like picture schedules, because you've got kids that probably aren't reading yet, but like this, and this, like pictures. And then you can use green and red are really super helpful. So like I'll give you the example. I've worked with so many kids that just want to be on the computer, but because of the concrete literal thinking, and I'm not saying this is true for all the kids, but it's amazing. Like if I put a red stop sign on the computer, that means not right now. If I flip it over to green, then it's all yours. Same with like tape. Like we've got like the different color duct tape. Like I often have kids that don't know boundaries, and so like I don't want you come and be to the behind the teacher's desk. I'm just going to put red line where you can, where you can go, and where or the red line means don't cross this. It sounds simple and it doesn't work for all, but when it does, it's amazing. So keep that in mind for sure. Um, Giving concrete examples of expectations. So again, um, if you're like clean your desk or clean the area around your table or clean your room, that's very abstract, right? So for many people we get that, but what you can do are really give concrete examples. If they're older, you can maybe write what it looks like and they kind of checklist it. But if they're younger, take a picture. Like this is what it looks like. This is what I expect. And then just things like if they are having to take things home, like color coding, like if it's green, it stays here. If it's in the green folder, it stays here. If it's in the red folder, it goes home or whatever. Those kind of things, just really being concrete. I talked a little bit about executive function challenges. I just want to let you know, again, going back to the executive function component, one thing that's really interesting to me is that we are able to do a cognitive shift to some degree. We're all, again, stronger or weaker on our executive function skills. But um, students with executive function deficits don't make that shift quickly. So often it looks like, oh my gosh, they don't follow the rules, they don't follow directions, they're non-compliant. And that is true sometimes. But also for these kiddos, typically, and this has to do with the transition thing that we talked about earlier, it is very, very challenging and takes more processing and more time for them to shift from here's what we're doing, here's what we're talking about, I don't need to work on this anymore, to and now we're here, which for most of us, we can do that like that. But for our kids with executive function challenges, that can be a huge component that leads to us thinking they're naughty. So keep that in your brain. I also, we already have talked a lot about transitions. So give these kids extra time, extra visual cues. We've got tons of options out there for like visual timers now, where the red slowly goes away, so they can see how much time they have left before something's going to change or happen. Schedules, those kind of things can really help with transitions. And then just briefly, I love that I need a break card or system. There's two ways to do it. And the first is kind of scheduling it in to their day. So you're like, okay, by the time they've gone through their fourth rotation, they're just like they're overwhelmed. And so we know between 3 and 4, activity rotations, they're going to need a break. You got to determine what that is, what that looks like, what works best. You got to teach it explicitly how they take a break, and then what the break looks like and how to come back. But you can build it into their sort of schedule. But then ideally, and this is maybe a little bit more for our older students, but ideally what I actually want is that our kids can understand their emotions, their needs when they're overwhelmed, and that they need a break. And we've come up with a system for how they can ask for it, what it looks like, how many times they can do that. I can talk to you guys about this for hours. I've seen so many really good things about teaching I need a break. So please reach out to me if you want more information about that. I'm wrapping up here pretty quickly. There's going to be some more slides on here that I won't get to, but as I mentioned before, I want you to make sure that you have access to this information so you can go back and look at it. I want you to think about it's kind of like Maslow's hierarchy, but it's a little bit different. So I want you to kind of think about a pyramid of supports and teaching our students our skills. So they're not going to be, so the first thing you want to think about is sensory and biological needs. And we've talked about some of those sensory things. We don't have a ton of control over biological needs because we don't control what they eat in the morning. We don't control if they got sleep, if their parents gave them their meds. And Lindsay, I'll see you. I'll get right to you in just a second. And so, we can only control what we can control. But if this kiddo needs uh, a snack, you've learned that. If they need a sensory break, those kind of things. And like if you guys are here learning and you're not you're not regulated, you're not going to learn. Next is reinforcement. We talked about that. So you just want to be like overwhelming with the reinforcement supports that you give those kids when you're teaching behavior. We talked about visual needs, tactile needs might be some of those, like fidgets or pacing. Again, like I was talking about the tape. I've got a lot of kids that I've worked with that were pacers, and I do like a green square that they could go back and forth in the back of the room so they know where they can pace. Task demands. We want to make sure that we're actually asking our students and expecting our students to do something that they can do, which often, as I mentioned before, means differently than their peers because they can figure it out without needing explicit teaching. And that's when we get to skills to teach. Okay, Alicia, I see your hand raised. Can you come off mic? I don't know much about this on the webinar. Uh, Alicia, or put it in the chat. Okay. Maybe it was an accident, but I'm here for you. Oh, thanks. Thanks, Alicia. Okay. Um, I'm done. I'm done. Okay. Please consider these things. The only other thing I'm going to tell you before we leave is that we've gone away from talking about high functioning and low functioning. You're still going to hear it, you're still going to read it, but in the community, we're talking less about a label and more about support needs. So a high functioning student might have less support needs, still have struggles and have support needs, but they're more like mild support needs. Our low, severe students are more complex, intensive support needs. We're not labeling them, we're talking about the amount of support that they need. Okay, I just don't have much time. I'm done. Autism Internet modules, please go look at it. You will love it. It's free. Any of these tips that I talked about, tools, you can go on there and you can learn more. You can send parents there. You can send your paraeducators. You can send your administrators. Like if you don't understand about like a social story, go here. Okay, I think I'm done. Please, you guys, I'm begging you, if you don't mind, take this QR code and just give me some feedback. Like, this is really helpful for me in my job to make sure that I'm getting you the information that you need and can make changes. I know that this was a really quick presentation. I'd love to talk to you more if you ever want it. So please reach out. I think that's good unless anybody has more questions in the chat.